We just want to welcome you. So we've never done this here before, and we've never worked together on something that kind of feels this big, but we're glad you're here. And I'm Allison Cover.
And I'm Katie Bean.
And I started teaching cooking and health classes a few years ago when I was working in oncology as a nurse, and I was talking to some patients, and I asked them, I don't remember what the issue was, but I asked them if they ate vegetables, and I had people confidently tell me, yes, I eat lettuce on my hamburger. And I kind of realized at that point that you haven't learned it yet, and maybe you already know this, but vegetables are really good for like every chronic disease that we have. And so I started doing cooking classes, well, probably about 12 or 13 years ago. And I've been blessed to have Katie come alongside me. So I'm going to let her introduce herself.
So I grew up with a love of cooking and baking and everything, and I found Allison's cooking classes in 2017-18, and at that point I was vegetarian. But her classes really teach me that eating plant-based is really good for you, and not just something that my mom lied about growing up eating more veggies. So I've been working with her for a couple of years now with the classes, and our goal with the classes is just to teach people how to incorporate more plants, eating more whole foods plant-based diet in their life. And so we're really excited for this event to kind of branch out and bring a little bit more information, especially pertaining to breast cancer and in different ways for prevention and lifestyle and all of that. So we're really glad that you're here with us today.
So I don't know, is there? Katie's cooking. She's an amazing cook and baker.
I frantically kind of put on some more kind of shoes to book my way out, but we've been in the back. I've been with John and Nan. We've been they're working on some delicious curry, and we've got a kale salad. We've got some really delicious walnut cookies that we'll have here on the break for you guys, and so a whole slew of things towards the end of the afternoon. So our event here will have a couple different like segments, and then we'll have a break here in a little bit. Yeah.
I think I'm just going to do my thing.
Take it away.
All right. So I wanted just to, why is this not? Okay. Jay, it was on, but I can't, I'll just do it the old-fashioned way. Okay. So we have water in the back if anyone needs a drink. There are also drinking fountains around the corner. If you go out these doors and to the left, there's a bathroom. So if you need the restroom, it's there. Also wanted to let you know that we are going to be recording these, and we're using the microphones because it needs to go to the video, and it will be available. So if you have friends that you think would benefit from this and you want to share it with them, it will be on a website so that you can share it. Also, I haven't talked to a couple of presenters, but I think we're going to be able to have all of the slides also available so that you can look at the slides and be able to share those with your friends as well. I know that Eva out front said that a couple people wanted copies, and I didn't make enough because I didn't know who might want extra copies, but we can make sure you get those. So fairly quickly. So if you want those, you could you put your name on that sign-up sheet and an email and say, I want the slides or something like that, and we can share them with you. Okay. The other thing that I really want to let you know is that the presenters are going to be talking about general information pertaining to breast cancer and like the average person. So this is not going to be specific medical advice for any particular person. They can't do that. I'm a nurse, I can't do that. I can't give medical advice that way. And so I just want to let you know that anything you hear, if you have a question about it, you can talk to us and you can look up research, and you have this research so you can advocate for yourself, but please speak to your primary care provider or your specialist, whoever you're talking to, before you do anything drastic. Yeah. Okay. So why are we here today? I kind of told you why. My personal interest is that I think I grew up thinking that people had a lot of information that I found out that people don't have. And I feel like we can make decisions only when we have the information. If we don't have the information, you're really not making a decision. Someone's telling you what to do. And that's in all areas of life. And I passionately believe that people are smart enough to make decisions for their own health. So that's kind of where this all came from. A lot of people hear that breast cancer is due to genetics, which kind of means that you have nothing you can do to fight breast cancer or stop breast cancer or treat it once it's happened. It's just, something that either happens to you or it doesn't happen to you. But multiple sources say that only 90 to 95% of cancers are attributed to family genetics. Other way around. Are not attributed. I forgot a not in there. Boy, nobody shared this until I fixed that. It's the other way around. Are not attributed to family genetics. Wow. I knew I was going to make a mistake. That was a big one. Okay. It's the other way around. So only 5 to 10% of cancers, all cancers, this isn't breast cancer, this is all cancers, have to do with the genetics that you're born with. When you look at so this is all cancers again, the approximate percent that's linked to diet is 35% of cancers associated with diet. And if you look up the American Cancer Society, or if you look up Susan G. Komen, or you look up any of the breast cancer information, they will tell you that eating a healthy diet and exercising is important. That is mainstream knowledge. What's not as mainstream is kind of how to do that. And so that's kind of what we're going to talk about. 30% are related to tobacco use. 14 to 20% are independently related to obesity. So that may not necessarily be the same diet issues. 18% are infectious agents. So that's like herpes or some of those other viruses. And then you have about 7% that are related to radiation or environmental pollutants. So really what this tells me is that we can control our diet, right? We pick up a fork and we know what we're putting in our bodies. And so this allows us to make the decisions that can have an impact in our lives and our families' lives. 1 in 8 women in the United States will develop breast cancer in her lifetime. That is skewed to older age, but the things that you do when you're younger affect that older age risk. I just wanted to show you this. So I did a really quick back of the envelope calculation on the population of Spokane Valley, Post Falls, Coeur d'Alene. I looked at the rates, and just in those cities, so that's not all the little tiny towns in between, this year, 250 women just in this section are going to develop breast cancer, or be diagnosed with breast cancer, I should say it that way. Will be diagnosed with breast cancer, give or take a handful. But statistically, that's a lot of people. That means there are a lot of people out there who have, are going to get diagnosed in the next few months, are going to undergo treatment, and are going to be living after treatment. And so what we really want you to have is the information to make choices so that hopefully you're not one of those 250 people. And if you are already one of those 250 people, the information we're giving you today can help you not have it come back. And it also helps with all the other chronic diseases. Dr. Esselstyn says, genetics loads the gun and lifestyle pulls the trigger. So even for a lot of things where the genes are changing, the lifestyle that we have, the food that we eat, we go walking, all of those things are going to change whether or not we actually develop breast cancer and will affect whether we have it come back or not. I'm going to turn it over to Annalee, who's way more eloquent and just an incredible friend of mine. And is that not showing? Okay, hang on. I'll get here. Work? All right. You're going to introduce yourself, right?
Yes, I will.
I couldn't get it. Let me see. Jay fixed it, so I'm just going to. Okay, now you have the power.
Okay, perfect. Okay, hi everyone. My name is Annalee. I'm a nurse practitioner that works in oncology. And as Allison said, I'm one of her good friends, and we were both very passionate about plant-based diet and lifestyle medicine. And so she asked me to come and give a talk about breast cancer and breast cancer prevention today, which is convenient because lifestyle medicine and this sort of thing is one of my favorite things to talk about. So as I said, I'm a nurse practitioner in oncology, so I see people every day who have been diagnosed with breast cancer amongst other cancers. And this is basically an opportunity for me to talk about things that you guys can do in your day-to-day lives that can decrease your risk of breast cancer. Or as Allison mentioned, if you already have it, decrease your risk of having it come back and have better treatment outcomes. I think people underestimate how powerful lifestyle changes can be, and so I just want to really emphasize that today. So my favorite part of lifestyle medicine is nutrition, and I think before I dig into specifics of what types of specific foods you want to eat, I think it's better to look at the whole big picture first. And a good way to do that is to look at some of our leading cancer organizations and what they recommend. So most of these organizations put out guidelines as far as what they recommend for diet and exercise and that kind of thing. So the first of them is the American Institute of Cancer Research. See if I can get this to open, which I highly recommend is just a resource about cancer in general. I guess I should have tested these links on Allison's computer first. I don't know if I'm going to get this to work. Okay, well, you'll have to take my word for it. So American Institute of Cancer Research specifically states they recommend a plant-based diet, and they go into guidelines about how much fiber you should eat, what types of specific foods you should eat. MD Anderson Cancer Center and Memorial Sloan Kettering Cancer Institute are two of the top, like every year you see these rankings come out about cancer centers, which are the best in the country. They're always in like the top 3 typically, so you know that they're a reliable source. And they also both call out specifically on their websites that they recommend plant-based diet or a more plant-based eating. And so the question would be, why is that? They're clearly looking at the data and coming to that conclusion for a reason. So the first aspect I want to focus on is fiber. We have a lot of data showing how healthy fiber is, including for other disease states and leading causes of death, not just cancer. It's also a useful marker. We can look at if someone has a high fiber intake, that tells us that they're eating healthier in general. And when I'm talking about fiber, I'm talking about fiber from food, not like Metamucil, et cetera. So there is data showing specifically to breast cancer that a high intake of total and soluble fiber is associated with reduced overall breast cancer incidence. Whoops. And in addition, insoluble fiber, which is just one of the fiber types, is found to be suggestively inversely associated with breast cancer risk as well. So then, of course, you wonder why that may be. We do know that fiber lowers insulin by improving insulin sensitivity. Insulin is a growth factor, so it promotes cell proliferation and growth, and higher insulin levels are linked to increased risk of cancer. Fiber lowers estrogen levels. It does that at least partially by blocking reabsorption of estrogen in your gut. And it's associated with decreased obesity. So generally speaking, higher fiber foods are lower in calorie density. So if someone's eating a lot of those in their diet, they're going to be getting less calories and they're less likely to be obese. And that's kind of an oversimplification. This slide, it's a big long quote. I won't read it to you, but I just thought it was interesting how they called out, the authors in this study called out so many different ways that fiber could be having its effect as far as decreasing breast cancer risk specifically. It shouldn't be underestimated, and if you focus on nothing else in your diet, I would say trying to increase your fiber intake is probably the most powerful thing that you could do. So for a goal, the AICR says at least 30 grams per day. I put in some quantities of how much fiber is in certain foods just to give you an idea of what that would look like. Fiber is only in plant foods, and it's good to get a good variety, so don't just rely on lentils, for example. There's actually different types of fiber within different plant foods, which is kind of interesting. Beans and whole grains generally are going to be where you get the most bang for your buck, so emphasize those. Lentils are a powerhouse when it comes to that, and beans in general are. They're also cheap and easy to use and put in a lot of different foods. So you could see if you just had 1 cup of lentils, 2 tablespoons of chia seeds, and like an apple, you would already be over that 30 grams per day. I think really people should shoot higher than 30 grams per day, but that's they say at least. So I think everybody can do that. And then moving on, so vegetables, as Allison already mentioned, we do have data showing, this probably is not surprising to anybody here, but the more vegetables that you eat, the lower your risk for breast cancer. They've looked at specific components in vegetables, so carotenoids, that's rich in, like, for example, red peppers and those sorts of red and orange vegetables. Folate and others have demonstrated a protective effect against cancer. Cruciferous vegetables, which are broccoli, kale, Brussels sprouts, cabbage, etc., they contain something called glucosinolates, which have demonstrated an anti-cancer effect in lab studies. And I think, Allison, because you said you were preparing a kale salad, right? So we're going to take advantage of that. And then, of course, vegetables also have fiber. So, and again, this is probably an oversimplification. I'm sure there's ways that vegetables are protective against cancer that we don't even know about yet. Another thing that's not as obvious about a plant-based diet is the type of fats that it generally contains. So most people have heard there's saturated fat, there's trans fat, there's unsaturated fat. It tends to be that saturated and trans fats are associated with increased risk of breast cancer. They cause DNA damage and lead to obesity, which is an independent risk factor for cancer. And animal and processed foods are the largest sources of saturated fats. So obviously, if you're eating more of a plant-based diet, you're going to be eating less animal and processed foods, and that means you're going to be eating less of the saturated fat and trans fat. Meat specifically, there's been multiple studies that have linked higher meat intake with increased risk of breast cancer. This is particularly strong for processed meat, so that's going to be things like bacon, ham, salami, bologna, etc. 64% greater risk in postmenopausal women who consume processed meat versus those who don't. And then with red meat, 25% higher risk in those eating the most versus the least. What's interesting about this is that the timing of exposure matters. So girls and adolescents who are eating more meat tend to have an increased risk of cancer later, which they think is because that's when breast tissue is developing, so it's sort of a vulnerable time. So 1 serving a day of red meat during adolescence was associated with 22% higher risk of premenopausal breast cancer. And then in early adulthood even, you see that increased risk as well. So the recommendation would be to avoid processed meat and limit red meat, especially during adolescence. So this is a big one. It's probably one of the biggest myths out there about breast cancer nutrition. How many people have heard that soy contains estrogen, so people shouldn't eat it because it increases risk of breast cancer? Yeah, so it's common, and it's actually sort of, you can't really blame people for thinking that way because we know that higher estrogen increases the risk of breast cancer. Your soy has estrogen, so it would be natural to conclude that you don't want to eat soy. The truth is actually the opposite. So when they studied it, soy actually protects against breast cancer, and that's because the phytoestrogens, which are not exactly the same as our own endogenous estrogen, works differently in the body. So specifically, soy tends to bind estrogen receptor beta, whereas our own estrogen tends to bind alpha and beta. Alpha happens to be the receptor that, if that's the one that's binded or stimulated, increases risk of breast cancer. Beta does not have that effect. So when they've actually studied it, there's a 35% lower risk of hormone receptor positive, which is just one of the types of breast cancer, and 40% lower risk of hormone receptor negative breast cancer, and then decreased risk of recurrence as well. High consumers, so that in this study they looked at, that would be 10 milligrams of isoflavones per day, which is not that much. A cup of soy milk or 3 ounces of tofu would, actually 3 ounces of tofu would double that, is what they were looking at in that particular study. And again, we see that consumption in adolescence seems to confer a particular benefit. So you have that window of opportunity there again. And I just want to mention that this is looking at whole foods. So you see a lot of like plant protein supplements, et cetera, that have soy isolates in them, and that is not what they're studying. They're looking at whole foods specifically. Other protective foods, mushrooms, have been associated with a decreased risk of breast cancer. They are also rich in antioxidants, and they have immune modulating activities. So those shiitake, maitake, portobello in particular have been studied. There is a toxin that's in mushrooms that is only there when they're raw. It gets broken down when they're cooked. So I just encourage people to cook them before they eat them. And then green tea, there's been some studies showing decreased risk of breast cancer with increased green tea intake. So that would be another thing that you could just think of as an add-on to your healthy diet. Flax seeds also contain phytoestrogens, different types, but they've been shown to bind estrogen receptors and decrease cell growth. They also contain omega-3 fatty acids, so unlike the saturated and trans fat that I mentioned earlier, omega-3 fatty acids actually have healthful impact and decreased risk of cancer. And then last one would be turmeric. This one I don't believe, or at least I couldn't find, had been studied a lot like in people in breast cancer, but they do have laboratory studies showing that it has anti-cancer effects, and we know that it's very anti-inflammatory, and so it's something that, again, is easy to add into your diet. So Allison mentioned obesity already, and I just wanted to call that out because it is a significant risk factor for breast cancer, especially in postmenopausal women. So when you have extra or too much adipose or fatty tissue, we know that it secretes inflammatory substances and increases the production of estrogen, and both of those things contribute to your breast cancer risk. Specifically, so we talked about insulin before, it increases levels of insulin, which itself promotes cell proliferation, and then it also eats up this protein that is supposed to bind sex hormones, and so if estrogen is not bound to that particular protein, there's more estrogen available to go and do its thing in the body. I did not talk about smoking. I assume everyone here knows that smoking increases risk of cancer and that no one here needs to be told not to smoke, so I don't have any data on that. But I do think it's worth calling out alcohol just because I think in our society alcohol kind of gets a pass. It seems like, well, even healthcare providers were saying for a while, like having a glass of wine with dinner is healthy and it's good for the heart, et cetera. When looking at breast cancer, at least, even light drinkers have increased risk of cancer compared to people who don't drink at all. So the less, the better, essentially. Why that would be, so alcohol breaks down into a toxin, which causes DNA damage. It creates reactive oxygen species, which again creates DNA damage and inflammation. People who drink heavily tend to not absorb certain nutrients as well, so you'll actually see like in alcoholics where they have low levels of folate and other nutrients that are important including for cancer prevention. And then alcohol, a lot of people don't realize, actually increases levels of estrogen as well. Physical activity, this one probably won't be surprising to anybody, but women who engage in moderate to vigorous activity over 3 hours per week have 30 to 40% lower risk of breast cancer. Sedentary time in particular, watching TV, is linked to increased risk. The more time spent sitting, the worse off you are. And interestingly, actually I would say for most of the things I talk about, but including physical activity, this protective role holds even for those with genetic mutations. So BRCA1 and BRCA2 are two of the common mutations most people have heard of. Even if you have one of those mutations, exercising regularly can decrease your risk. There's likely multiple mechanisms at play to explain this. Obviously, exercise helps you maintain a healthy weight, helps decrease your insulin levels, decreases estrogen, inflammation, helps your immune system work better. There's probably others that we don't quite understand yet. With exercise, it's one of those things where doing anything is better than nothing, so just not being sedentary is a good place to start. So that can be walking or, using a standing desk, things like that. Really a good goal though is 150 minutes per week, and that doesn't need to be like, you know, an hour at a time. It can be 5 or 10 minutes at a time. But if you hit that 150 minutes per week threshold, that's where we see a lot of the really big health benefits come in. Any is better than none, but the more the better, essentially. Sleep is something that also doesn't get enough, I think, respect, I guess you would say. We kind of act like we'll sleep when we'll die, and you know, we're all so busy and we have important things to be doing, so sleep sort of gets pushed to the side. But there are studies suggesting a correlation between increased risk of breast cancer and short sleep duration, so less than 7 hours, as well as poor sleep quality or disturbed sleep, or having it take a long time to fall asleep. Also, too much is bad. So when they look at it, people who, or women who sleep over 9 hours per day, also have increased risk of breast cancer and mortality related, both related and unrelated to breast cancer, which I think probably speaks to if someone's sleeping that much, they probably have some other health issues going on, and there's a reason they're sleeping that much. But it's like many things in biology, you want to hit the sweet spot of getting 7 or 8 hours of sleep per night. Also circadian rhythm specifically, so this means, you know, sleeping when we're meant to sleep and being awake when we're meant to be awake. If that gets disrupted, so for example with a night shift, there's increased risk of cancer that has been shown in some studies. So the International Agency for Research on Cancer actually says night shift work is probably carcinogenic to humans. One possible mechanism is that when we're exposed to light at night, it reduces our melatonin levels, and melatonin has been shown to have anti-cancer effects, so you're basically suppressing that. I think just to harp on the light exposure piece a little bit, a lot of people are on screens like their cell phones and watching TV, et cetera, when they're in bed or before bed. And that probably is suppressing melatonin and potentially increasing risk for cancer and other diseases. So the take-home message is that much like what Allison already said, a lot of this is under our control. I think a lot of people mistakenly believe that cancer is just bad luck, and there certainly are cancers that are, you know, it's purely genetic, but those are rare. There was actually a study in the journal Nature. They called it intrinsic factors, are the ones we can't control, so that would be genes, your age, et cetera, influence less than 10 to 30% of the most common cancers. So that means 70 to 90% are influenced by things that are under our control. Additionally, even after cancer diagnosis, lifestyle plays an important role in how people tolerate treatment, and has implications for survival. So in other words, even if you've been diagnosed, it's never too late to start making those changes and reap the benefits. So I think that was it. Does anybody have any questions? Yes.
When it comes to flax seeds and omega-3s, do you think that that is sufficient to get all the omega-3s that you need, or do you think we need to supplement?
So that's a good question, and I don't know that anyone actually knows the answer to that for sure. So omega-3s have ALA, which is like a precursor to EPA and DHA, and different people convert convert ALA into EPA and DHA differently. So some people are better than others at doing it. Premenopausal women tend to be better at it because it has important implications for pregnancy and stuff. So like men and older women, for example, probably if they're just relying on flax seeds, they may have trouble getting enough. There's actually blood tests that you can do to check and see what your level is. So if you're wondering about that, you can get a test. Otherwise, it's really easy to go to the store and find a supplement that's vegan, you know, algae-based EPA and DHA. If you're worried about it, or if you get a blood test and it says you're not getting enough. But flax seeds also have a lot of benefits besides the EPA, so even besides that, they're a good thing to include. And they do need to be ground. I can't remember if Allison already said that, but flax seeds should be ground before you eat them. Otherwise, you don't get they'll just pass through your digestive tract intact and you don't get the benefits. Yes? So I think that, see what they had in, or what I had in my slide. There's not necessarily like one cutoff. I think shooting for a tablespoon per day or so is reasonable. Thought I had in here somewhere, but maybe not. Yeah, I guess I didn't. But I would shoot for around 1 to 2 tablespoons per day, and I would grind it up, and then it's easy to put like on top of salads or in oatmeal, etc. Yeah.
What about like range-free chicken and grass-fed beef with no hormones, no antibiotics, stuff like that?
So all of this research that I'm quoting is looking at things that are inherent to the food itself that are not, don't have anything to do with whether something's grown organic or conventionally. So like, for example, when you're talking about like fatty acid composition, or if something contains something that, like processed meat's a good example that has a lot of ingredients that contribute to inflammation. Those don't change if something's grown organically or grass-fed or not. I guess you could say with grass-fed there would be a little bit more omega-3 component, but there's still going to be a lot of saturated fat. And so I don't think those things are going to make enough of a difference to make it change from a limit these foods to eat more of these foods.
Because I read the book called The China Study,
Mm-hmm.
and he said optimally, this was over like he did 37 different studies over like 20 years, and he said optimally the plant diet would be the best to prevent cancer or reoccurring cancer, but he also said like 5% of like range fish, chicken, grass-fed beef, but he said no more than like 5%.
Yeah, so I think the key in that is the proportion of the plant foods to the animal foods. I don't think it's ever been studied if someone's consuming 5 to 10% animal foods, whether or not it's organic or grass-fed, and what the implications are for health outcomes related to that. But I mean, you could make the argument that if you want to include some portion of those foods, it probably would be better to do the organic and grass-fed. I just don't think you should rely on that alone to feel comfortable increasing substantially the amount of those foods that you're eating, because I think there's still inherently aspects of those foods that are harmful to health and increased risk of breast cancer, regardless of how they're raised or grown. Does that make sense?
Yeah.
Any other questions? Oh. She's bringing the microphone.
Are the ground flax seeds more effective than liquid or the flaxseed oil?
I think I would buy the flax seeds whole and then grind them right before you use them. So as soon as they're ground and it's being exposed to light, or any of the normal environmental exposures that start to degrade nutrients, you start to lose the omega-3s. And so I would assume in a liquid form they've already lost that and are continuing to lose that that value. So I think the sooner you grind them before you use them, the better. It's easy to do with just like a coffee bean grinder or a spice grinder if you just have it sitting on your countertop. All right, any other questions? Allison has something to say.
I was just actually going to ask you to explain the soy and estrogen thing, because I find myself befuddled every time I try and explain it to somebody, but it makes sense when you explain it.
So,
Unless you just did that because I was in the back telling them that we're super speedy and it's almost time for their demonstration. But if you just did that, then ignore my question.
No, that's okay. So we have different types of estrogen receptors in the body, specifically alpha and beta. Endogenous estrogen, which is the estrogen that we make, affects both alpha and beta receptors. Alpha receptors, stimulating those will promote cell proliferation and breast cancer in the right circumstances. Stimulation of the beta receptors actually has more of the opposite effect, and soy does the latter, so it primarily affects the beta receptors as opposed to the alpha receptors. Yeah? Okay. Okay.
So if someone needs to have, or if someone's starting menopause and they are having hot flashes and they're going to go to their primary care provider and potentially some type of hormone therapy is going to be recommended,
Uh-huh.
are there alternatives to that that are
So
reasonable?
they have studied soy for that purpose, and I think it's had mixed results. And one of the reasons they think that might be is because some women are able to convert in their gut. They can get the end products of the soy that relieves hot flashes, and some women can't convert those products, the soy as well. And so I think if someone's wanting to avoid hormones, I think it's worth a shot. And certainly women with breast cancer are told to avoid any estrogen for hormone replacement therapy if they're hormone receptor positive. So I certainly don't think it would hurt to try it, and some women get benefit from it for sure. So
Question two?
yeah.
So thinking about the receptor positive breast cancer, I've heard women tell me that they're also told not to eat soy
Uh-huh.
because of that estrogen effect. I haven't looked at the research on that particular aspect, but because it affects a different receptor, do you find that it's okay for them to eat soy?
Yes. So, and they have actually studied that in even for hormone receptor positive breast cancer. So women who've had hormone receptor positive breast cancer, even if they consume soy, they have a lower risk of having recurrence than if they don't, or high consumers do have lower risk than lower consumers. So that holds true regardless of the hormone receptor status. Any other questions? All right, I think there's food back there.